Good evening, everyone. Welcome to the Safe at School Back to School workshop presented by your American Diabetes Association. I am Crystal Woodward, ADA's director of its Safe at School campaign. I am also the mom of a daughter with type 1 diabetes, so I understand and have firsthand experience of all the challenges and concerns you're having about diabetes management at school. But first off, I want to let you know that we are recording this session, and a link to this session will soon be made available on ADA's website and social media platforms. Next slide. Next slide. There we go. And then the next slide. Yes, thank you. Second, the information you received today from ADA does not constitute legal or medical advice. For legal advice or representation, contact and consult with an independent attorney, and for healthcare consultation and advice, consult with your professional healthcare provider. The first part of this evening's session will provide an overview of Safe at School and will cover federal and state protections for students with diabetes. We'll also talk about essential written plans like the Diabetes Medical Management Plan and a Section 504 plan. And we'll let you know how to access ADA's online resources and tools. After the presentation, there will be time for questions and answers. As you are watching and listening to this presentation, please be sure to type your questions in the chat box, and we will answer as many of these questions as we can. Next slide. Thanks to Xeris for its support of Safe at School and our soon-to-be-released updated school guide, Helping the Student with Diabetes Succeed, a guide for school personnel. Now on to our presenters. Jennifer Baldwin, BSN, RN, CPN, CDCES, works as a nurse care manager in the Center for Endocrinology, Diabetes, and Metabolism at Children's Hospital of Los Angeles for the past 6 years. She has 27 years of nursing experience and is a member of the Association of Diabetes Care and an education specialist, as well as the American Diabetes Association. She has been a Safe at School advocate and chair of the Los Angeles Safe at School Working Group since 2020. She also has been living with type 1 diabetes for the past 36 years. Welcome, Jen. Dr. Beth Braun is a wellness expert specializing in diabetes management, nutrition, and behavior modification for over 25 years. In her private practice, Dr. Braun works with adults and children faced with diabetes burnout, anxiety, and depression. She works closely with JDRF, ADA, and several diabetes camps, running groups on how to stay motivated and integrate body and mind wellness. She currently runs groups for children and adults with type 1, as well as parents of type 1 children, and she's also a member of the Los Angeles Safe at School Working Group. Dr. Braun has lived with type 1 diabetes for 47 years. She knew since she was a teen that she wanted to help people with the emotional challenges of diabetes. Welcome and thank you, Beth and Jennifer. Now I will turn today's important Safe at School program over to you, Jennifer. Thank you. Jennifer, you're on mute.
All right, sorry about that. All right, thank you, Crystal. I'm going to go ahead and get started today. ADA's mission is to prevent and cure diabetes, as well as improve the lives of all people affected by diabetes. This includes children and youth living with diabetes and their families. We deliver our mission through three primary areas: research, information and support, as well as advocacy and public awareness. Today's program will focus upon advocacy, namely the association's Safe at School campaign and how the campaign can help you to prepare to send your child with diabetes back to school with the comfort of knowing his or her diabetes needs will be safely met. The ADA's Safe at School campaign is based on three principles regarding diabetes management in school. Number one, all school staff members need to have a basic knowledge of diabetes and know who to contact for help. At minimum, everyone who has custodial responsibility for your child should understand diabetes, know how to recognize a low, and know how to get help. Number two, the school nurse is the primary provider of diabetes care, but other school personnel must be trained to perform these care tasks when the school nurse is not present. These tasks include insulin and glucagon administration, blood glucose monitoring and CGM, carb counting, and the recognition and treatment of both highs and lows. And number three, students should be permitted to provide self-care whenever they are at school or at school-related events. This applies to students who possess the maturity level and skill set to do so. The organizations listed on this slide agree with the Safe at School campaign goals and principles. These goals and principles help foster a safe environment for both children and their families with diabetes at school. The American Academy of Pediatrics, American Association of Clinical Endocrinologists, the American Association of Diabetes Care and Education Specialists, of course, the American Diabetes Association, the Academy of Nutrition and Dietetics, Children with Diabetes, Disability Rights Education and Defense Fund, JDRF, or the Juvenile Diabetes Research Foundation, Pediatric Endocrine Society, Pediatric Endocrine Nursing Society, as well as the Endocrine Society. Schools adhering to Safe at School principles are best positioned to achieve these goals and to ensure the safety of your child while he or she is at school. As parents and guardians of children with diabetes, we know it is important for our kids to have their diabetes management needs met to keep them safe and healthy in the classroom and at all school-sponsored events and activities. Here are three key goals for school diabetes care while in school. Schools must provide a medically safe environment for our children. Our children must have the same access to educational and school-related activities as their classmates without diabetes. Schools and parents need to work together to support the gradual transition to independence for children with diabetes, as we all know that diabetes is a self-managed chronic condition. One example of this might be, if your child is deemed independent in their diabetes care, they should be allowed to check their glucose in the classroom to avoid further disruption in learning. As parents and guardians, we know that diabetes requires 24/7 management, and our children, as well as parents, can never take a break. Parents and guardians should work with their schools to ensure smooth coordination of diabetes management between home and school. For example, if your child self-manages at home, it is a reasonable expectation that they may continue to self-manage at school. However, parents and caregivers do need to recognize that home and school settings may vary. You may change your child's insulin pump site at home, but be aware that your school nurse or school staff may not be able to do that, and they can elect to use a backup plan of insulin pens or syringes in the case of a pump malfunction or a bad site. You may be able to make treatment decisions based on CGM data at home, while the school nurse or school staff should still be able to use that CGM data. They cannot be expected to respond to every single data point. Parents and guardians need to make sure that the school clinic has all the supplies needed to care for your child at school. Independent students may also carry their own supplies, but it's usually a good idea to have a backup supply of insulin, glucagon, test strips, as well as snacks available in the clinic. Fluctuating out-of-range blood glucose levels may negatively impact learning and behavior. Students with diabetes may need accommodations to address this, such as extended time for homework, class assignments, and even tests. Parents and guardians should make sure that written care plans, including the 504 plan and the diabetes medical management plan, are developed before the school year begins or before your child returns to school after diagnosis. What does your child need at school to manage his or her diabetes? Timely access to a school nurse and/or trained school staff is very important. Train staff to recognize and be able to treat highs and lows. School-based emotional support, as well as psychological services as needed, may be provided at the school. Proper physical distancing measures and/or virtual learning, if that's what's best for your child. Self-management should be permitted for capable students. Full and safe participation in all school-sponsored activities. Access to accurate carb count and nutritional information, as well as access to all supplies, equipment, medication, and food. Parents and guardians of children with diabetes have some extra back-to-school shopping and preparation to do. Please approach in the spirit of cooperation. Your child will be in school for a very long time and is dependent upon the school nurse and staff for help and support. Work together toward a shared goal of keeping your child safe, healthy, and best positioned for success. Please remember to be realistic. We are all only human, and also remember to be reasonable. All perspectives must be respected and considered. Listen to the school's concerns and be ready to help brainstorm to come up with practical solutions. Communicate early and often with school personnel who will be in direct contact with your child, including bus drivers, coaches, and other special interest teachers and/or advisors. Be your child's advocate, but maintain an open mind and willingness to listen to others' concerns. Don't forget to provide a complete kit of current, clearly labeled supplies, snacks, including complex carbs like peanut butter and crackers, and fast-acting forms of carbs like juice or glucose tabs. Encourage your child to wear a medical ID in case of an emergency. The school nurse is the coordinator of care at school, but often parents and guardians may be aware of a problem or challenge before the school nurse has any knowledge of it. We encourage you to keep the lines of communication open and provide the information that the nurse needs to make accommodations in the care plan while at school. Remember to build trust so that you can bring concerns to the attention of the nurse, and also remember to be willing to be a part of the solution.
Thanks, Jen. So, our legal protections. Understand the relevant federal and state laws that give legal protection for students with diabetes and place the legal obligations upon the schools to provide appropriate diabetes care for your child and to make sure your child is treated fairly. There are federal laws and multiple states have laws that provide protection to our children. I strongly recommend that you go to the ADA's website to learn more about these laws and understand how they work. See how you can use the laws to ensure your child's diabetes management needs are met during the school day and at all school-sponsored events, including field trips and extracurricular activities. I'm going to say this website several times, so learn it and live it. diabetes.org/safe@school. Will become a chorus of that. It is so important to remember. Children with diabetes have legal rights that do not go away during a pandemic. Students with diabetes should have a 504 plan, IEP, or other written accommodations. Our children cannot be excluded from school-sponsored activities because of their diabetes. Individual assessments are required because every student is so different with their numbers. Families in schools need to be open-minded and flexible with the school care and adapt to ongoing changes and implement precautions if needed with COVID. All right, let's do this. Here is a summary of the federal legal protections for children with diabetes. Section 504. Public and private schools, including religious schools that receive federal funds, have legal obligations to provide diabetes care under Section 504. Under this law, diabetes is a disability that may limit a number of major life activities such as walking, talking, eating, and endocrine function. The activity that is limited does not only have to be learning in this case. Students who qualify for services under Section 504 should work with the school to develop what is called a 504 plan. And we will talk much more about this specifics later on in this talk. Then there is American with Disabilities Act. And this applies the same way as Section 504, but it also applies to daycares, camps, and recreational programs. Religious schools, though, are not obligated under the ADA laws. A written accommodations plan should be put in place for students and children who are eligible for the services under Americans with Disabilities. Now, the state laws and regulations. While all schools must comply with the federal laws I just mentioned, there are also state law considerations. States have nurse practice acts and other laws and regulations that impact who may or may not provide care to students with diabetes. And then to add to our confusion, some policies and practices differ within school districts. Yes. Check with the American Diabetes Association's website to see if your state has these guidelines. Regardless of your state's laws, the requirements of the federal laws always must be met. That means if you live in a state that only allows a school nurse to provide care, then the school nurse must be available full-time, not just part-time. That's a biggie. And the school nurse must go on field trip and attend all extracurricular activities your child is participating in, but not a spectator. Then know that some states have passed school diabetes care laws or developed school diabetes management guidelines, or have changed relevant Board of Nursing regulations to enable trained school staff to provide care to our children with diabetes. To learn more about this, I'm going to give you a guess where you can go. diabetes.org/safe@school.
Thank you, Beth. Now I'm going to review the written plans. So there are two key types of written plans that parents and guardians should be aware of. They're called the Diabetes Medical Management Plan and the Section 504 Plan, or Other Written Accommodations Plan. Students who are eligible for service under IDEA will have an individualized education plan, better known as an IEP. These written plans are essential to make sure the school meets the needs of your child in accordance with your provider's instructions, and to also make sure your child is treated fairly and that they are successful in school. This slide details the 5 plans that schools commonly use to either document and or support the delivery of care as it is prescribed by the student's healthcare team. The first is a diabetes medical management plan, or DMMP. I want you to think of this simplified as it is just the doctor's orders. The DMMP specifically outlines what needs to be done to manage a particular student's diabetes. The DMMP is written by the healthcare team, but it also should include input from both the student and the parents and guardians. It is also signed by the healthcare provider. A 504 plan is a broader accommodations plan developed under the Section 504 of the Rehabilitation Act. A 504 plan accommodations documents reasonable accommodations needed to support academic progress and ensure equal opportunity. It is written by the 504 team. This team includes the student, the family, the school nurse, teachers, and administrators. I want you to think of this plan as what are the details about my child that will help them be successful at school related to their diabetes. And an individualized education plan, or IEP, is required for students who receive any type of special education and related services under the Individuals with Diabetes Education Act, or IDEA. An IEP plan, or an IEP, I apologize, includes a section on health, but it is a comprehensive document that addresses all areas of students' education and related services. It is written by the IEP team, including general and special educators, related service professionals, administrators, parents and guardians, and of course, the student. Your child will not have an IEP and a 504 plan. If they require special education and have an IEP, the 504 plan details will be added to the IEP. If they do not have any special education needs, they will only have a 504 plan. So either a Section 504 plan or an IEP may include implementation details from both the DMMP that either duplicates or replaces a separate IHP plan. Whatever plan is used, it is vitally important that the school health team makes the time to fully document the specifics of how the doctor's orders, or DMMP, will be carried out in the school setting. The final document I'm going to talk about is called an IHP. It is an individualized health plan, and it documents how the medical management, as specified by the provider in the DMMP, will be implemented across all school-sponsored events and activities. This document translates the DMMP into a plan that works in the context of a particular school, building, or program. That is, it identifies who, when, where, and how will all these diabetes care tasks prescribed by the healthcare team will be carried out at school. The IEP is written by the school nurse, but is developed with input from the school health team, including the student, family, school nurse, and other school staff. I hear many times that schools and school nurses may say, we will create an IHP for your child. There is no need for a 504 plan. Please be aware that we want you to still have a 504 plan in place. The IHP just helps the school figure out who's going to do what. The 504 plan helps all of those people keep your child safe and successful. There are also 2 quick reference plans provided in the ADA School Guide, formerly known as the NDEP, or National Drug Education Program Guide. These plans provide information on the recognition and treatment of hypoglycemia as well as hyperglycemia. The American Diabetes Association also provides a sample DMNP plan that can be shared with your child's diabetes provider. Many states do have their own versions. No matter which plan you use, parents and guardians as well as providers should make sure all aspects of diabetes management at school are addressed in accordance with the ADA's sample plan. The DMMP, individualized for your child, by his or her diabetes provider serves as the foundation for the development of your child's 504 plan or IEP. The DMMP is prepared by the student's diabetes provider. It is a comprehensive plan and includes information such as level of supervision that the student requires, medication doses, how to manage lows as well as highs, and ketone management. The DMMP may also include specific instructions for diabetes management during field trips, school-sponsored activities, and even unplanned activities such as lockdowns and disasters. Diabetes management may be different with different levels of activity and different times of day. So what this means is in the event of a lockdown or disaster, if your child has to be at the school, they need to understand what the carb ratio might be for dinner. It may be a different carb ratio than what is happening for lunch. So we do have to kind of think outside the box and remember to be prepared for things like this. Here are some main components of the DMMP. Be sure to check out the ADA's sample DMMP for other provisions to consider. Any DMMP should always include emergency contact information for both the parent and even the endocrinologist. It should include information about blood glucose monitoring and CGMs and how often are we taking a look at those items, glucagon administration, information about exercise and sports, recognition and treatment of both low blood sugar and high blood sugar, insulin administration, meal and snack schedules, and the level of self-care. How much supervision do they need? Parents and guardians should approach the development of their child's 504 plan proactively and collaboratively. That is, develop a plan even when things are going well. We want you to understand that staff or situations could change even tomorrow. Many people will tell me, the nurse is so good with my child, we don't need a 504 plan. Well, that nurse could maybe win the lottery tonight and not come to school tomorrow. And if it's not in writing, the person that is asked to step in her absence won't really know what to do. Accommodations should be reasonable. It is safer for your child if everything is in writing and everyone understands their role. That's why these documents are all very important. A DMMP or healthcare plan is not a substitute for a Section 504 plan, IEP, or other written accommodations plan. So why is it so important for a student to have one of these plans in place, either the 504, IEP, or other accommodations plans? And what are these benefits to having these plans? It provides validation of the health condition and what the student needs to function optimally. The student and the parents better understands the accommodations that are available to help them focus on their education, such as unrestricted access to the health office or restroom, having access to water at all times, things like that. These plans utilize a formal legal process for determining how their needs will be met, and it also can address the needs that are not being met. Please know that if needs are not being met, you can request additional meetings to collaborate with the school team on how better to meet those needs. These are some initial steps and considerations for the parents and guardians in beginning the 504 or IEP process. Parents and guardians should begin this process by contacting the school's 504 or IEP coordinator. This often is typically the school principal, vice principal, guidance counselor, teacher, or it can be another school staff member. Requests should be confirmed in writing. In fact, it's a really good idea to always keep a written log of all your communications with the school when navigating through this process. So it's highly recommended that all your requests come in some sort of written form, such as email, letters, because of course, verbal communication can never be tracked in the future. The school may initiate the process if a need for services or special education is suspected. The school districts may require an individual assessment to determine if a child is eligible for services under these laws. For example, a formal assessment is required for an IEP to determine if the child is eligible. With either plan, a team will be convened to discuss the child's eligibility. Remember, I talked about the difference between these two plans. Diabetes automatically qualifies your child for the 504 plan in and of itself. But if they have education needs, even if those education needs are derived due to their diabetes, they must have an IEP, and the 504 or any of the accommodations will be added to the IEP so that there is one document to look at for school staff so they don't get confused. Once eligibility has been established, the team will convene to develop a written plan called Section 504 plan or an IEP. These plans are important pieces of your diabetes toolkit for all children living with diabetes. Don't wait until there's a problem. 504 and IEP plans may include COVID-19 related content. For example, implement community COVID-19 prevention strategies, providing 2 separate health clinics at school to include well and routine visits, and for those kids that are sick with possible contagious symptoms. Schools should make sure that they're providing clean and disinfected desks, counters, doorknobs, handles, light switches, electronics, medical and plastic playground equipment, drinking fountains, toilets, sinks, faucets, and other frequently touched surfaces. We want to make sure that the school can optimize ventilation and improve air quality. They should not be sharing any equipment such as musical instruments and keyboards. They should also not be sharing food with other students for infection control. More information about this can be found at diabetes.org/SAS-COVID. So go ahead and check that website to find out more information about COVID-19 in the school setting so that you're up to date on the most recent information. Next action steps. What do you need to do next? We want you to stay current on routine vaccinations, including COVID-19 vaccinations. Be knowledgeable about your current CDC guidance related to schools and your school district's policies. If applicable, check and comply with school mask policies. Encourage your child to take care of his or her own diabetes when they're at home and at school. Please keep six students at home. Seek support from mental health professionals for social, emotional, and behavioral issues. Here are some of the actions you can take to make sure your child is safe at school. Make sure your child's treatment plan, Dmmp or doctor's orders, is current and complete. Make sure they contain specific schedules and orders for the frequency of giving insulin, the current doses of insulin, and insulin to carbohydrate ratios. Know which staff have been trained to provide diabetes care to your child. Remember, some state laws do allow teachers and other school staff to be trained to give insulin and glucagon. Be a resource for the school. While it is the school and the school district's responsibility to train their staff, you may also help the school identify trainers. For example, some healthcare providers do offer training opportunities as well, and there also are training resources available on the ADA's school website, and that can be found at diabetes.org/school training. It is important to provide current contact information in case there is an emergency or if the school needs to clarify information about your child's diabetes management. Always provide plenty of supplies and food for your child. Extra supplies should be stored in a place that is accessible to the school nurse, school staff, and to your child if he or she self-manages.
Beth, you're on mute.
Sorry, guys, always something. Resources. It is really up to parents and guardians to get this information to the schools. You can't expect them to know this all. get the information to school nurses, principals, teachers, as well as other school staff. Safe at School online resources can be found at, ready, say it with me, diabetes.org/safeatschool. Diabetes care and task training modules for the whole school personnel are available for free at diabetes.org/school training. Other training resources can also be found at diabetes.org/SAS training. Our website also has comprehensive information for students who attend universities, as well as trade schools and vocational schools. It covers Section 504, American with Disabilities Act, and explains how to navigate the 504 process post-high school. Please be aware that after high school, the plans have a different name rather than 504 plans or IEP. The post-secondary guide or post-high school guide and related resources are available at diabetes.org/college rights, even though it covers other programs. Okay, childcare, because we do have young children with diabetes. Those resources and tools can be found at diabetes.org/childcare. These resources are intended for anyone caring for younger children who may be at daycare, camp, and community programs. This was so much information. So what do you do now and where do you start? Number one, be your child's advocate by reading the information on, say it with me, diabetes.org/safeatschool. Read about the legal rights, written plans, and understand the types of support that is available. Check our Safe at School web pages frequently for updated COVID-19 information and resources, and that is under diabetes.org/SAS COVID. Understand your school district's COVID policies and consult with their diabetes provider to determine what is best for your child. Then, as Jen said, schedule a telehealth or in-person visit with your child's diabetes care provider to develop the child's updated Dmmp for this school year. Do that as soon as you can. Do not wait till school starts, please. Then get ahead of the curve and schedule a meeting with the school nurse and or principal to review the Dmmp, preferably before the first day of school, because the buildup to each school year is so much for them. Help identify training resources on our website to educate the school staff about diabetes. Initiate your 504 or IEP process and make sure to update your child's plan if they had one last year by contacting your school's IEP coordinator. And then how can you get involved? Become an American Diabetes Association influencer or volunteer with your local chapter's advocacy committee and get invited to meet with lawmakers on diabetes laws and priorities. You can also join ADA events at diabetes.org/ADA influencers. So now, here you go. You have all the key information for a safe and healthy school year. It's as easy as that. I'm kidding. It takes planning, education, training, a giant amount of communication and teamwork. Okay, there is not an exam at the end of this, so don't worry. And I also wanted to let you know we have some more Safe at School events coming up that are national. Be sure to check American Diabetes Association social media for registration links and they will be available soon. I hope to see you at summer at some of these important sessions to help parents truly prepare to send their child back to school. These events include our expert roundtable for Safe at School on July 28th, and make sure you know pre-registration is available. And under, you guessed it, diabetes.org Safe at School. And then August 9th, we have a big one. I really hope you will join because I will be a part of it, and so will Crystal. American Diabetes Association, JDRF, and Sansum Diabetes Research Institute are co-hosting a national Safe at School expert panel discussion. Definitely need pre-registration, and the link is available at, say it with me, diabetes.org/Safe at School and our social media. So now, here are all the links from today's program, and I highly suggest you take a screenshot, copy them down, whatever works best for you. And I really am grateful you all joined us. When I was a young kid in school, all the way through high school, we did not have these laws protecting us. And I am so grateful to be a part of this committee, helping kids. There is a big difference when you take an exam or a quiz or perform in gym class when your numbers are very high or very low. So try to understand why these laws are so important and protect your student. Thank you, everyone.
Thank you, Beth and Jennifer. That was great. Lots of great information, and adding your personal touch certainly made it very relatable to parents and providers and diabetes educators who are all watching and learning and taking notes. But we do have some questions for you, and I'll start with the first, and you can just chime in. What to do if a school aide doesn't support a type 1 child because she doesn't understand and doesn't get it?
Well, I think I can definitely speak about this right now. So I think it's really important to be able to keep those communication lines open. So I would, definitely start communicating with the school nurse about what the concern is, so that maybe they can sit down with them and provide more training, so that they can identify what the gap is, so that that aide can provide care that really meets the needs of your child.
Mm-hmm.
Thanks, Jen. The next question is, my son's school stops every 504 meeting. He still doesn't have an appropriate 504 plan in place. How do I get the district to finish a meeting? That's a great question. How do we nudge this along? How do we move this process along?
Well, as we talked about earlier, it's very important that any communication that you're having with the school be done in writing, so that you have everything documented. So I do think it's important, like I said, as long as everything's documented, you should be able to definitely reach back out to the principal and find out exactly, or whoever the 504 coordinator is, to figure out what the issue is, so that your child can get the 504 plan that is highly recommended, and to keep them safe at school. Typically, if you're having issues at the school level, there may be ways to go above the school level, but you really need to start with the school level. Maybe Crystal can add a little bit more about what you would do to formally move forward if the school was not open to meeting about a 504 plan.
Well, to keep the process flowing, I think it's important to document and put everything in writing, which both of you already mentioned in the presentation. Also, work your way up the chain of command. Know who the 504 coordinator is at your child's school. It could be a school principal. It could be a guidance counselor. It could be a teacher. So I would reach out to the 504 coordinator and find out, why is this taking so long? There's some concerns. Is there some information you're waiting for? And then get them to set a date for the next meeting, to commit to a date, and to commit to a date to finish the plan. Unfortunately, in the current 504 regulations, there is no requirement that schools finish writing a 504 plan within a time certain. Hopefully that'll change someday. Hopefully the regs will get tightened up someday soon. But that's, part of the issue. So I would just say you have to stay on top of them. And at this point, I would put everything in writing. Copy, to the 504 coordinator. You may want to copy the superintendent of schools and just work your way up the chain of command. Yep. Okay, next question. My child is 3.5 years old, attending a private nursery school in the fall, not old enough for universal pre-K in New York. The school district is creating a 504 plan for my daughter that recommends a one-to-one nurse at a private nursery school. The nursery school does not have a nurse on staff. Are there programs, federal or state, that reimburse the private nursery school for the cost of the one-on-one nurse? If not, we are being led to believe the cost must be covered by us, the parents. I would say, I'm just going to go ahead and answer that. I think that, that's a New York specific question. There may be something unique in New York that requires the public school district to pay for health services in private nursery schools. I don't have the answer to that because that is local. And my recommendation would be to consult with a local attorney to learn more about what the rules and regulations are in New York. I don't know if it's New York City or New York State, but I would consult with a local attorney. That's definitely a local question.
Yeah, the other thing I'd like to mention here too, the key is, it is a publicly funded preschool or is it a private? That's going to be an important thing to remember. And then the other thing I want to make people aware of is that many of these private schools have accepted government funding for COVID. We all heard about, all these schools needed extra help to get everything back in place, getting supplies in place to help kids stay protected. So if they've accepted funds, even if it was just for COVID, it kind of moves them to a different area. They are now considered publicly funded, and they really do have to follow more of the law. So I definitely agree with Crystal. You need to reach out to somebody at your local level that knows about these types of schools, probably, or these laws. Probably an education attorney will be your best option.
Okay. Thanks, Jen.
Mm-hmm.
Next question. My son is 4 years old. My Dmmp states he needs a one-on-one at school. I was denied an IEP at preschool because he passed the IQ evaluation with flying colors. The district said they can't help me because he doesn't meet the IEP requirements for preschool. I pushed the wall of IDEA but had no luck. I hired a private aide who is a health professional in order for my son to attend preschool this year. For next year, I am going to reapply for an IEP since the laws change in New York once you're in kindergarten.
All right, so as we discussed today, IEPs are going to include health-related information, but your child has to be evaluated, which sounds like that happened last year. But IEPs are only needed if there is any special education needs. Okay, so it sounds like they tested them and possibly they didn't identify any education needs. So if there is no special education needs, then you just focus on the 504 plan itself. And so that they should allow you to do that. And like I said, the 504 will focus on just what your child needs to remain successful and healthy and protected in school.
And I would just add that, you know, the school has to meet the provisions of the 504 plan. And if the family and the school have agreed to this aid, then it's up to the school district to fund that aid. And again, it looks like this may be taking place in New York. I don't know if it's New York State or New York City, but New York City public schools are unique. I found them to be very unique from schools in other parts of the country, in that New York City public schools many times provides a one-on-one paraprofessional for younger children with diabetes. I don't know that's the case here because I'm not sure, Josette, if you're from New York City or New York State, but just know that that is a common practice and process in New York City public schools. So I hope that's helpful. Okay, the next question is just, will this recording link be shared? Yes, it will. The link will be sent out to all attendees, and it will be widely available on our social media platforms and our website probably sometime next week. Okay, another question. Do you have any suggestions on how I should approach the IEP differently? I need the IEP over the 504 because I want the district to pay for the one-on-one moving forward. I am sending him to a religious school, so I need the IEP to be approved to provide funding to my aide. Thank you in advance. And I believe this is the same person who asked the previous question, which is very similar to this question. I don't know, Beth or Jen, if you had anything additional you wanted to add.
Yeah, so I think the challenge here is, of course, it's private. And so, you know, there are different, you know, unfortunately, private schools, whether it's religious or not, they have different rules that they must follow. So obviously finding out, did they ever get any public funding? Because like I said, once they've gotten public funding, they have to then step up to what any other public school has to follow. I think that's a good thing to figure out if you can. And then as far as the one-on-one, Crystal, do you have, I mean, I know in my state, there are times that a health insurance may cover the one-on-one. Maybe there may be a way to cover it that way.
Yeah, I think, you know, generally the practice nationwide is that schools do not cover a one-on-one aid. And I mentioned previously, I know New York City public schools, that's the exception. They do provide, many times provide paraprofessionals for younger children, but generally schools do not have to provide a one-on-one aid in order to meet their obligations under 504 or the Americans with Disabilities Act or IDEA.
They do have to meet the needs of your child, though. So that, you know, just
absolutely they do.
They have to follow the orders.
They have to follow the orders, but it most of the time it does not require a one-on-one aid. Mm-hmm. Okay. What is the protocol with the school bus? Our school district contracts the bus out. We never had the same bus driver, and I'm sure most of them had no clue about my daughter's type 1 diabetes.
I had this situation in California with one of my patients, and with the changing bus drivers, it turned out to be a group of 4 or 5. And what this parent did was go to the bus drivers, where the bus drivers were leased from, and talk to them and had the drivers trained through the ADA website. and all of the supplies were really kept with the kid, and numbers were checked before this young lady, it was a very young lady, she was in kindergarten. Before she got on the bus, they wanted to make sure she had snacks and was at a halfway decent number. Otherwise, they would have mom or dad come get them.
Yeah, I think it's important to make sure if your child does ride a school bus, that the information about that is discussed in the 504 plan meeting, so that you can make sure from the get-go that you have made sure or requested that anybody involved in your child's care, including the bus driver, understands how to recognize the symptoms of a low, how to recognize the symptoms of a high, and they should at least understand about glucagon administration and what to do in these situations, like call the paramedics. And typically what we do with most kids, at least in my practice, that either walk to school, ride a bike to school, public transportation, or even a school bus, is that the parent, before they go to school, maybe gives them a little bit less insulin or a little bit more carbs, so that they don't have, because they may be active, so they don't have a low on the way or right when they get to school. And the same thing at the end of the day, getting a blood sugar or a CGM reading. And if they're under a certain number, maybe they need some carbs without insulin. We don't recommend a large correction right before getting on the bus, because that, also can, put them up, set them up for a low blood sugar. So there are some other things that you can do to kind of hopefully prevent this from happening, because it is a scary thought for everybody. But getting things like that added to the school order. So talk to your provider about that, and then addressing the school bus driver and things like that in the 504 plan will also be important, and understand, to make sure they've been trained.
I just want to add that it's the responsibility of the school to make sure the bus driver is informed and trained. And also, it sounds like things need to be changed up here, that it should be the same bus driver, or at least if it's not the same bus driver, to make sure that the bus driver has been trained. But that responsibility to train and inform the bus driver does fall upon the school, and in particular the school nurse. And that becomes part of the 504 plan, and also the individualized healthcare plan, which is the school nurse's roadmap for the provision of care to students with diabetes, at school, on the bus, at extracurricular activities. All of that needs to be addressed, and that is a responsibility of the school. So I think we have time, Beth and Jen, for one more question, and then we're going to conclude the program. Where can I go for help if the school is refusing snacks and blood checks? They make her go in a corner to check her finger and tell her she's a distraction.
Wow.
Beth, do you want to take that one?
Well, it's under your child's protection federally if this is a public school. I have had this happen to quite a few of my children. I've had children that had to go to the nurse's office to do any insulin administration or blood sugar testing. And so that's where you as parents or guardians become the child's advocate. So we don't know from this question if it's a public or private school, but we have to make your child as comfortable as possible and not allow this impact their ego. And legally, they are allowed to do this, absolutely allowed to do this, and not be sent off to the corner. I would wonder if this is school administration saying this or the actual teacher.
And get everything into that 504 plan. That is so critical. Snacks, blood glucose monitoring, where it takes place, when it takes place. If your child can self-manage, we want to make sure that's incorporated with the 504 plan. So important to get that written 504 plan. Even if everything's going well at school right now, and school nurse is very accommodating and wonderful, and the teacher is on board and has been trained and recognizes lows and knows how to treat, even if everything's going perfectly, get that 504 plan in place while everything's going well. Anyhow, lots of great questions, lots of good information. So thank you all. And everybody, thank you for attending ADA's Back to School virtual session tonight. We hope the guidance and information provided has been helpful to you. And thanks again to Beth and Jennifer for taking the time today to share your time and your expertise. It's much appreciated. Please know your American Diabetes Association is here for you. A link to this session will soon be available along with the rest of our back to school virtual sessions. If you'd like to watch it again, if you want to share it with parents and others who are responsible for providing care to our children. For information and specific recommendations about Safe at School, as Beth said, please go to diabetes.org/safe at school. Also, please be sure to register for our upcoming Safe at School Back to School expert panel on July 28th by going to our Safe at School webpage. And again, many, many thanks to Xeris for its support of Safe at School and our upcoming revised school guide. Have a great evening, everyone, and wishing you all a very successful, healthy, and safe school year. Take care and good night.
Good night. Thank you.
Good night.